I'm Meshal Malik and you're watching Indus Special. We find ourselves fighting against the biggest health crisis of our lifetimes. And in the struggle to learn more about the nature of this disease, we are also learning more about how it is impacting different groups differently. Deeply embedded social inequalities and racial narratives are now becoming more pronounced. But how exactly is this discrimination exacerbating the crisis we are seeing? We discussed this on today's show. Joining us for this conversation is Dr. Rashawn, who's a professor of sociology and a Rubenstein Fellow at the Brookings Institution, joining us from Washington, D.C. Also joining us is Mr. Peter J. Lee, who's an associate professor of East Asian politics at the Social Sciences Department at the University of Houston, joining us from Texas. Thank you both for joining us and welcome to the show. Mr. Peter J. Lee, I'd like to begin with you. Now, when we talk about racial discrimination becoming more pronounced, this is especially holding true for the Asian community all across the world. You being in the United States, how have you seen this evolve, this issue evolve ever since the outbreak first erupted?
Yes, in the last few weeks, we have seen rising number of verbal and even physical attacks on Asian Americans, Chinese Americans in particular, largely because of course, the pandemic, which was, associated with, with China, and especially when, media persons and politicians have failed to send the accurate information to the society, and especially when some politicians using the word Chinese virus, which has caused some big confusion, if not encouragement to a section of the population who is very agitated against Asian Americans.
Right. You're talking about the misinformation that's been circulating, which is causing this issue to aggravate. Can you take us through what you feel has been some of the underlying themes of this misinformation or some of the posts we see on social media, which is causing this backlash against the community?
Yeah, one of the misperception is that this virus, of course, nobody has denied, especially the Chinese government has not denied that it outbroke in China. And it was, traced to a wildlife market in Wuhan of China. And but, the thing is, it's more like, caused by the mode of production. When you have a large number of animals in a concentrated environment, you're likely to have a pandemic or epidemic to break out. So when you associate this, pandemic with a particular nation, particular culture, you are causing problem. And as if it's, a pandemic associated with a particular group of people, or the Chinese people are more likely to contract the virus. So that's why, the society seems to be, totally confused.
Right. Dr. Ray, I'd like to pull you into this conversation. Now, as we talk about the Asian population and some of the backlash that they are facing all across the world, there is something specific to the United States that we're seeing develop, and that is specific to the African American community. Now, you tweeted on this in which you talked about COVID, and I'd like to quote your tweet. You said COVID-19 might not discriminate, but the United States healthcare system sure does. Give us an insight into what you mean by this.
Yeah, so what I meant by that is in the United States and around the world, we're seeing that COVID-19 is impacting everyone, regardless of their race, ethnicity, nationality, socioeconomic status, gender, and age. And of course, it plays out slightly differently for age and gender. But in the United States, the healthcare system is extremely unequal, similar to the rest of our society. And so when this first happened, it was assumed that it was going to be something that was going to impact certain communities more than others. And instead, what we've seen recently in Michigan, Wisconsin, Illinois, Louisiana, is that the number of people who have been diagnosed with coronavirus, as well as the number of people who have died, has disproportionately impacted the Black community. In fact, in those states, Blacks have been 74% more likely as compared to their percentage of the state to contract coronavirus. And so part of this misinformation that Professor Lee talks about is also impacting not only the Asian community as it relates to discrimination, but also the African-American community as it relates to their ability to get treatment and their ability to actually to actually recover coronavirus. And I think people really, really have to realize the depth of this. What this is getting at is that there isn't testing centers in predominantly Black neighborhoods. There aren't healthcare providers in predominantly Black neighborhoods. So by the time they do come to the hospital, coronavirus has advanced so much that they're unable to recover from that. And this is embedded in the unequal distribution of resources as it relates to our healthcare system in the United States.
Right. Just to put this fact out, you already stated the various states and various cities in which this is happening as an issue. In Michigan, where the state's population is 14% Black, African Americans made up 35% and 40% of the deaths. Now, that's a staggering figure, and that it can't go unnoticed. Do you feel like this issue, now that it is brought into the spotlight, now that we're actually seeing statistics come out, there is a greater response trying to help these communities get access to healthcare?
I hope so. I think, again, one of the big issues, and Charles Blow recently talked about this, if you look in New York City, for example, and again, I think these racial disparities are playing out. There are politicians in the U.S. who are asking for racial data. Policymakers and academics are asking for racial data across the United States. Part of the issue is when you look at where the testing centers are and some of the ground zero centers in different parts of the country, they are not in predominantly Black neighborhoods. And even in a place like New York City, in the way that they have restricted transportation, it could take someone an hour to get to a place where they can actually be in a facility to get tested and to also get treatment. And part of what people have to realize is that the unequal distribution of resources as it relates to healthcare in the U.S. means that it's a racialized system, means that it's also a system based on economics. It also deals with medical distrust. It deals with a collective memory that the healthcare system has not treated African Americans as well as Asian Americans the way that they should be treated, which is equally. So it's embedded in a lot of ways. And there was a recent report that came out looking at nearly 200 countries around the world. And it found that while the United States was supposedly the most prepared for a pandemic, and their score wasn't great, it was only 84% out of 100, but the scores were extremely low for the United States as it relates to healthcare. And this is the way that we are seeing this play out in the United States. It's a big problem. It's something that even if people are noticing, it's something that is going to have to take drastic structural changes to actually correct some of the things that we're seeing put in place.
Right. Mr. Peter J., now we're seeing the problems within the health infrastructure all across the world. And these issues, as Dr. Ray pointed out, were deeply embedded. They're just becoming more and more pronounced now that we are living in these times. Let's talk a little about what happens when you try to racialize a pandemic, the way that it's being done across the media, across social media. How does that hinder the fight against it?
Yeah, definitely. I totally agree. Yeah, especially if the government has failed to respond to the crisis in a timely fashion. And, the government is not ready in terms of the medical supplies and, comprehensive readiness. And definitely, prioritize certain groups of people as opposed to others. So that's why, when the pandemic, first outbreak, United States has not been responding, as quickly as, some other countries should have been. There has been a lot of blame, going out, saying that, other countries could have notified the United States earlier. But we have to understand that when China shut down Wuhan toward the end of January, it was sending a strong signal to the rest of the world that you guys have to get ready. So if we had prepared earlier, we would be able to be in a better position to, serve all the people, if not everybody. But, we certainly would be better positioned and better prepared.
Right. Better preparedness would have been one of the things that come out if this narrative didn't exist, didn't surround this issue. Now, going forth with it, what do you see happening develop? China is almost recovering. China is almost going back to normalcy. All across the world, we're seeing this this lockdown, this draconian lockdown. This is, of course, a fostering ground for more conspiracies, for more narratives. What do you see happening in terms of an international effort to curb these rumors, misconceptions, and myths?
Misperception, falsehood do not help. right? Even labeling one particular the pandemic as associated with one particular culture, particular country does not help either. So it's important for the international community to work together. So this is the time that we should fight the epidemic or pandemic, not fight with each other. And also it's very important for the United States today is to look inside our country to see if there are anything that could produce problems like what was produced in China. Do we have a concentrated animal feeding operation? Do we have wildlife trade, cross national border? Are we abusing wildlife animals? All these, factors we have to look into. So what had happened in China could happen in the United States and could happen in any other countries. So it's important for the media and for politicians, especially the chief of the nation, to convey accurate information to the society.
Right. On that point, thank you so much, Mr. Peter D., for joining us from Texas and talking to us about this issue. Dr. Rashawn Ray, now the inequalities present in the healthcare system, we're seeing them become more and more evident. And what's becoming even more prominent is the fact that when you leave certain segments behind, thinking that it won't impact the majority or won't impact the 1%, it in fact does in situations like this. Do you feel like meaningful lessons are being drawn, which will then be implemented, which will then be used to reform policies?
Unfortunately, no, I don't think so. And I think it's a history in the United States that people need to know. It's a recent history. So when H1N1 hit around 2009 or so, what we've seen is that the United States wasn't as prepared as it should have been. But we were in an economic recession. And what happened at that point is President Obama then implemented a global pandemic response unit and put it firmly in the National Security Council within the White House. What that means is a person who is reporting regularly on what's happening around the world as it relates to pandemics. When Trump took over, he disbanded that unit. What that meant is that the United States wasn't as prepared. And to tell you how prepared that unit made the United States, when Ebola hit in 2014, there were only 10 people who ended up coming to the United States who had Ebola. It was instantly locked down, and it did not spread throughout the rest of the United States. And I really want people to think about what would happen if coronavirus was as deadly as Ebola is, as we're seeing it impact the Congo and other countries in Africa. And so part of what people have to realize is that it's structural and political. And so part of disbanding this unit means that the United States has been exposed. On one hand, as we just heard, we have Trump in the White House crossing out coronavirus and putting Chinese virus there. Right. That's leading to discrimination against Asians. On the other hand, we are seeing non-responses where people in rural areas, predominantly Black and Latino communities in urban areas, low-income communities, are not able to get testing, are not able to get to places where they can get treated. And we're going to see this get really, really bad in the United States because it comes down to structural inequality. It comes down to structural racism in the United States and a history of treating marginalized groups differently than the way that we treat people who are more privileged.
Right. Dr. Ray, the important point you brought up, and it's something that Mr. Peter J. Lee also brought up, which was about how the terminology of this virus, surrounding this virus in itself, is leading to further discrimination. That's a point I want to pick up with our next guest, Mr. Einar Tangen, who's a political and economic affairs commentator joining us from Beijing. Thank you so much, Mr. Tangen, for joining us and taking out the time. Now, talking about how this discriminatory language is being used surrounding the virus, referring it to the Chinese virus, the Wuhan virus, leaving aside the devastating impact it's having on the Asian community, how do you feel like weaponizing this virus will deal and work in the future for interstate relations?
Well, obviously, it won't be very good. I mean, there's a lot of backlash against the United States right now within Asian countries. And remember, when we say Asian, we're not talking about China. We're talking about every Asian out there. Most Americans do not know the difference. But, I mean, it's kind of a silly thing to do. I mean, you know, almost 20% of the doctors who are treating people in the United States today, 19%, are Asian. 10% of the physician assistants, 9% of the nurses, they're Asian. I mean, you're relying on these people to save you, and yet you're somehow blaming them. This idea of putting racism on top of this is simply the old playbook. I mean, this is something that Donald Trump and his administration has been pushing. Why? Because they want to get away from the blame of being incompetent in their handling of this. They had 2 full months to prepare, and from what we've seen so far, they did absolutely nothing.
Right. Mr. Tangen, now, one of the things I do want to get out of our discussion is to have a candid conversation about some of the things that are surrounding the racism, fostering, feeding it. Now, one of the does relate to the eating habits variant across China, the issue with the wet markets. Now, do you feel like the global narrative, the international narrative regarding those things is very different to what the on-ground reality is? And if it is different, how exactly so?
Okay, the wet market that you're talking about was in southern China, where there tends to be a larger appetite for exotic animals, the belief that they're good for you. But, let's put this into perspective. Wet markets are not a feature just of China. In fact, they've been disappearing rapidly. And after this last scare, you can pretty much guarantee that they'll never be here again. But if you start going throughout the rest of Asia, into Africa, Southeast Asia, even South America, you still have wet markets and things like that. This idea that viruses only come from wild animals is silly. The bovine virus, the swine fever, also avian flu, these are things that are going to cross over. The issue here is that you have a larger population on Earth, more urban environments. Whatever virus is out there is more easily spread. So, given that we've had, 9 occurrences since 2003 of novel viruses breakout from Ebola, MERS, you name it, it's quite probable that this is going to become an ongoing feature of our lives going forward, until we start to understand that, we need to make sure that the populations are safe, that medical care is available, and that we don't try to make this on some racist basis. No one is suing the U.S. because of Spanish flu or the swine virus, et cetera, et cetera. I mean, this is kind of silly. These things happen. They're going to continue to happen. The origin is not the issue. The issue is how you treat it.
Right. Dr. Ray, it brings me to another point in our conversation. Now, what we're seeing right now, this blatant racism across the world against different communities, do you feel like this is actually just a component of the larger wave of xenophobia, of the larger wave of racism that we've been seeing in the recent years due to the rise of right-wing governments?
Yes, I think so. And I think not only is it recent, I think it's very important for people to realize that it has a long and torrid history. If we look at Asian Americans and Asians in the U.S. context, but also around the world, and really, let's just talk for a second about what it means to be Middle Eastern in the United States, or perceived as Middle Eastern, because as we just heard, people can't readily tell the differences between groups. I mean, if you're framed as Asian or you're framed as being perceived as Middle Eastern or Latino or Black, that's how people view you, even if that's not necessarily your racial identity. So that's extremely important to note. And in the Asian community, what we see is a long and torrid history where anytime the uptick in immigration from certain parts of the world, in this case, Asia to the United States, starts to heavily increase, we start to see more racialization. And we can go back 100 years and look at this. We can look at when Chinese immigration was really high in the U.S. We can look at when Japanese immigration was really high in the United States. Korean immigration was really high. And what we're seeing now in the United States is that the number of Asians who are immigrating to the U.S. is higher than it is for Latinos. But in the past couple of decades, Latinos have been framed as being the kind of visceral group that's coming in, taking jobs and doing this sort of thing. Now we're all of a sudden framing Asians in a particular way, in a racialized way. And it has deep implications for people's everyday lives, not only discrimination, but also verbal assault. Also, people not patronizing Asian businesses that they previously went to. And so we really have to look at this. And then on the political side, it starts to impact immigration policy. So I'm very curious moving forward if we're going to see any rollback of the policies that are put in place. And people really need to pay attention to those things.
Right. Mr. Now, with the racist information disseminating from various platforms, from various media channels, from various politicians, and the fact that most of the backlash is falling on the Asian communities. Now, I want to focus on what do you think the governments of these countries that will have populations that will be suffering, diaspora that will be suffering, can do in this regard?
Well, if you had a responsible government, they wouldn't be trying to label things as the Wuhan virus or the China virus, etc. But the temptation here is when you get in a corner to start playing racist cards. But ultimately, it will backfire. One of the problems long term, and the reason that Trump is in office, is he played the white racist card. He said Hispanics, African Americans, Asians,
Right.
Everybody is the enemy. The only people who seem to be friendly are white. And in a country where the Caucasian population is declining, and you're going to have eventually be the largest minority, but other minorities will make up the majority. I mean, to give you political implications, the last election, the Asian vote was split in terms of Donald Trump. I don't think that's going to be the case this time around.
Right. Of course, this will have long-term political implications for the United States, in which we're seeing such a strong manifestation of this racism all across. Thank you so much, Mr. Einar Tangen, for joining us from Beijing, Dr. Rashawn for joining us from Washington, D.C. We're going to go for a short break. When we come back, we talk about how the discussion regarding climate change in South Asia is changing given our current context. Stay with us. Welcome back to the show. With the outbreak of COVID-19, countries across the world have enforced strict lockdowns to slow down the spread of the virus. An indirect and a more welcomed consequence of the situation has been the fall in carbon emissions. South Asia, one of the worst impacted regions due to climate change and air pollution, is after many years experiencing good air quality days. But are we learning permanent lessons from what is hoped to be a temporary crisis? Let's discuss this further. Joining us today is Mr. Chandra, Bhushan, who's an environmentalist and the CEO of iForest, National Forum for Environment, Sustainability and Technology. He joins us from New Delhi. Also joining us is Mr. Dawar, who's a climate policy consultant, joining us from Lahore, and Ms. Reena Said Khan, who's an environmentalist journalist who has also received the Earth Journalism Award in Copenhagen in 2009 for her climate change reporting. She joins us from Islamabad. Thank you all for joining us, and a very warm welcome to the show. Dawar, I'd like to begin with you. Now, when we're talking about good air quality days, how dramatic has the shift been so far ever since the lockdown was first imposed?
Well, thank you for having me on the show, Meshal, first of all. And just like beginning, we've noticed in Lahore how we went from AQIs, which are ranging from 300 at times down to 50 AQI these days. And what's happened basically is that the reports, the source apportionment that we have says that a lot of this pollution comes from industry and transportation. And now we've completely, or at least by 70 to 80%, minus all of this from our air. So what we're seeing right now is Lahore's baseline AQI, which basically means that without anything impacting it right now, the base or what the city is supposed to be like, and what minimal would you see in a city, that sort of air quality that we're seeing in Lahore right now. And just to give an example, the AQI range since 23rd March, since the lockdown went into full force in Punjab, has ranged between 80 to 60, which is a 24-hour AQI, which basically means that for the entire 24-hour period, most of us did have completely clean air. It was in the sense when you go with WHO standards, it would be considered moderate, but considering that it's not impacting anyone at all, not
Right.
impacting even vulnerable individuals, then it's considered very clean.
Right. Chandra, now given what we're seeing here, the situation unfold in our part of the region, do you feel like it resonates for you as well, especially being headquartered in New Delhi?
Well, it is an obvious outcome. Meshal, everything is closed down. No one is on the road. There is no vehicle. Industries are closed. So you would expect reduction in emission and improvement in pollution level. But as you rightly said, this is a temporary phenomenon. Experience of 2003 SARS epidemic, as well as H1N1 that happened in 2009, shows that this is a temporary thing that happens and then pollution level rebounds back.
Right.
And therefore, I don't think we need to do the same mistake as we have done in the past. This gives us an opportunity to understand what is going to be the baseline pollution level. And as the previous speaker said, the baseline pollution level in South Asia seems to be moderate, AQI of anywhere between 60 to 100. That is what the baseline is, which also tells us that there is more to pollution than industry and vehicles. There seems to be a significant amount of pollution that is coming from natural sources. And my guess is it is largely from land degradation. So we also have to work on ecological restoration if we want to really improve air quality and reach, say, WHO standard. But coming back to the point, we have moderate pollution level. This is the time to analyze all the data and then develop a long-term action plan so that we get permanent solution to pollution problem rather than this temporary phase that we are witnessing.
Chandra, sorry to interrupt here, but when you're talking about data, collection of data, what type do we need to be focusing on right now? Because we know all resources are dedicated to fighting the virus at this point in time. There's very little focus on trying to collect data to retrospectively try to work on the issue of climate change. But what do you think are some of the gaps that need to be focused on at this point?
Actually, automatic pollution monitors are operating. For example, in Delhi, we have right now more than 20 monitors which are giving us round-the-clock data. And all over India, we will have close to 200 monitors which are effectively giving us data. So we have data. I'm not saying that we need to shift resources from fighting COVID-19 to monitoring air pollution. I think the existing data that we have seems to be reasonably good enough for us to understand the baseline pollution level.
Right.
And what we need to do is now link that data with slowdown in the economy and understand how weather condition is affected pollution. Because mind you, this is also a season when air quality is generally good because the weather is good. This is a windy season in South Asia. And also it rains sporadically.
Right.
So this is what I was trying to say.
Right. I take your point there. Stay with me. I want to jump quickly to Ms. Reena Saeed Khan. Ms. Reena Saeed Khan, now this pandemic is different than, for instance, SARS and MERS, because the timing of it happened during when we were in the midst of a climate change emergency. There was a lot of talk. The focus, political focus, social focus was shifted to the issue, even if that just remained in the realm of rhetoric. But how do you feel like the impact of this pandemic will be seen on the conversation within South Asia regarding climate change?
Well, I think right now it's just too early. Governments are in firefighting mode right now. Pakistan is under lockdown, so is India. Actually, so many countries in the region and in Europe and the West. One casualty has been the climate change conference that was going to be held, the UN climate change conference that was going to be held in Glasgow in November this year. It has been postponed. They just recently announced that. So it's been postponed to some date in 2021. We don't know when. And then the intersessional, they have a in-between sort of climate talks in Bonn. They've also been postponed till October. So right now, everything is on hold. But, I mean, of course, the UN has said that they would like countries to take this time and ramp up their climate plans that they were supposed to submit by the end of the year, and they would like them to take more time and maybe learn from this. And because the skies, as you mentioned earlier, have cleared up almost all over the world. But right now it's really too early to say that will this really make a long-term impact on our policy when it comes to climate change. You really can't say for now. I think everything is on hold. And I spoke to our climate change minister, who's advisor to the PM on climate change, Malik Aslam, for an article I was doing just a couple of days ago, and he did mention that we really need to rethink, like especially given the example of Lahore, that there's a direct correlation between the polluting vehicles and the clear skies, and maybe we'll have like days when we stop cars on the road, and they're thinking about it, but it's too early for him to give me any definitive, sort of answer that yes, we are going to be doing this. But yes, they're thinking about these things now. And let's see what happens.
Right. Ms. Reena says not just the fact that climate change and the conversation regarding it, surrounding it will change, but also talking about the fact how will policies regarding healthcare, health infrastructure change? Because as we're seeing right now, the healthcare infrastructure is overwhelmed. That is also a prediction to match what will happen as the climate, as weather patterns worsen across the world, and especially within South Asia. Do you think that we will be able to recognize the large looming gap that we have?
I think we already had a crisis with like dengue, when dengue hit Lahore a couple of years ago, and then it spread to so many cities in Pakistan, and we never had dengue before. This was a direct cause of climate change because, tropical weather and the humidity, high humidity, and then the rainfall. And so we've already seen that response happening in which, so many hospitals suddenly had dengue wards coming up. And now you have isolation wards coming up because of the coronavirus and quarantine centers that have been readied. And I think Pakistan's response has been actually quite good this time around, and maybe that's due to all the Chinese experts who've been helping us and guiding us. But definitely, I think there's going to be much more focus on our healthcare as this pandemic plays out. That's one thing that's going to change. I think doctors and nurses, the health workers are just going to be, I think, probably be better paid, better, more attention given to that. I think that's inevitable.
Right. Dawar, just take us through, when we're talking about the health implications of climate change and the type of costs and the type of burden we're expected in the future, what does that entail?
To first divide this into two categories. There is going to be cost of climate disasters, and then there's also going to be a health cost of air pollution. Lahore in particular is more vulnerable to air pollution, and then peripheries of Lahore and different parts of Pakistan, like the northern areas, like Gilgit-Baltistan, Chitral, where we have seen climate disasters happening, then even the floods in the rural areas, those are the climate disasters which lead to a whole bunch of diseases that come out as a result of the disaster. When you put in people in refugee camps, when you have homes being destroyed, that results in a different sort of disaster. Air pollution, in a sense, creates vulnerability among the population, that you are going to be more vulnerable to respiratory diseases. For example, COVID results in a very strong attack on our respiratory system. So it's understood that countries in East Asia and South Asia, where you have higher air pollution levels, the individuals here will be more vulnerable. We've been lucky so far that we've been able to contain the spread. China was similarly lucky that they contained it to a certain province. We're seeing a rise in numbers now, but hopefully we can further contain them. And the result of these combined, the impact of this is that your public health infrastructure is overburdened. So currently we don't have enough data. There's just one report from Children's Hospital Lahore which shows that the number of cases being reported among pneumonia and other respiratory diseases increases considerably during October, November, December, the smog months. And this is back from 2017-18. So that's only one report. And now we combine this further with the air quality impact in all of Punjab and all of Pakistan, because every hospital should be gathering this OPD data, that this particular individual came with complaints of respiratory issues, which were triggered and specifically because of bad air quality. Right. So then we can perhaps also quantify it and put an economic figure on this as well.
Right. Dawar, this is the question I put to Chandra earlier as well. What gaps do you feel like exist in terms of data collection at this point in time? What do we need to urgently improve on?
That within our certain issues within Pakistan, none of the provinces have the infrastructure for source apportionment at this point. The monitors are single point source monitors, which are very few in number as well. And estimates say that for every 10 million people, you need to at least have a single monitor, at least that's the minimum that you can do. Ideally, you should have a monitor for every 1 million people. So that's not happening right now. There are certain projects in motion that will aim to make that happen. The monitors that we have in Lahore are mostly low-cost air visual monitors, and these just measure the PM 2.5 data. We aren't measuring PM10 levels, we aren't measuring the carbon monoxide, sulfur dioxide, nitric oxide, and nitrogen dioxide levels. And a lot of the analysis is based on satellite data. So right now in Pakistan, we need to be focused on gathering data regarding all these sources. And this will also, in combination with satellite data, help us pinpoint what are the sources. For example, industrial parks, transportation in cities, even solid waste burning or solid fuel burning, which happens in villages because they don't have access to CNG or LNG. They burn wood or other materials. So we can say that for sure at that point.
Right. I take your point there. Chandra, moving back a little and talking about something you mentioned earlier, which I feel like is worthwhile going back to, is the ecological balance you talked about. Now, climate change does intervene into the current conversation in many ways, but in one of the ways that is doing most prominently is saying that the disruption of various ecosystems will lead to a greater frequency of the pandemics like the one that we're witnessing right now. A lot of people are not able to understand the connection between those two. Could you take us through it?
Take the example of COVID-19. It is quite clear that in the 21st century, we have had higher frequency of zoonotic diseases. And as I said, we have had 3 pandemics this century, which is quite unique in a period of about 18 years, from 2003 to 2020 now. We have had 3 global pandemics: SARS, H1N1, and now COVID-19. In between, we have had Ebola, we have had MERS, we have had Rift Valley virus. There are a number of regional epidemics that has happened. Now, obviously, if you put all these zoonotic diseases together, you can bracket them in 3 categories. One is when animals and wild animals are coming together, and that is largely happening because of deforestation. And humans are entering in forest area, and there is jumping of virus or other microbes from animal to humans. The second reason is, of course, the cultural practice, which is, again, it has ecological links. Across the world, because of cultural practices and the culture of killing wild animal and exotic animal, which is also leading to jumping of virus from animals to humans. And the last is intensive farming. For example, H1N1 virus, the swine flu virus, started from an intensive swine pig farm in Mexico. Now, all these 3 things have linkage to the way we are dealing with our ecology. And therefore, if we are only looking at COVID-19 from the perspective of health, we'll do a big mistake. We have to look at this entire disaster from the perspective of environmental health, because they both are very, very strongly related. Right. And that's the learning. You cannot safeguard health by just medicine and vaccines. You will also have to take care of environment so that these kind of zoonotic diseases, their frequency is contained.
Right. Ms. Reena Saeed Khan, following from whatever Chandra briefed us on in terms of how we need to take a holistic approach to dealing with pandemics in the future, it's not just a health issue, it is in fact a climate change issue because it deals with various ecosystems. Do you feel like there are some lessons that are being drawn from the current scenario that will be implemented? I know you said earlier that it is too early to tell, but given that pandemics will become more frequent, do you feel like pandemic preparedness and issues on that front, there are policies that are being developed right now which will be implemented right after we emerge from this?
I think definitely it's going to be part of our climate discussion. But like I said, it's too early for the world right now. We haven't even peaked. Many countries, and we haven't, aside from China and maybe Singapore and Taiwan, other countries are going through we haven't even peaked when it comes to the virus. And so we are really, it's just too early to say. But definitely, I think the UN, backed by WHO, they're going to be taking this up. It's going to become part of our climate discussions. Our debates are going to change. The lessons we've learned, they will be pushed by environmentalists. And it's something that, definitely, by I think probably by the end of the summer, when the meetings start again, whether they do it, from home or, whether we do it all through the computer or we actually physically get together, these conversations are going to come up, these debates are going to start. But right now, it's just, the world is in firefighting mode right now. So.
Right. So I guess we'll just have to wait till the future to see with how much urgency these issues will be fought for, and with how much urgency will policies be developed to prevent pandemics like this in the future, prevent climate change, which is ongoing as we speak. Thank you so much, Ms. Reena Saeed Khan, for joining us from Islamabad, Dawar Hameed Butt for joining us from Lahore, and Chandra Bhushan for joining us from New Delhi. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.